Diagnosis of diabetes. Doctors use special tests in diagnosing diabetes and also in monitoring blood sugar level control in known diabetics. The healthcare professional will take a history including information about the patient's symptoms, risk factors for diabetes, past medical problems, current medications, allergies to medications, family history of diabetes, or other medical problems such as high cholesterol or heart disease, and personal habits and lifestyle. A number of laboratory tests are available to confirm the diagnosis of diabetes. Fingerstick blood glucose. This is a rapid screening test that may be performed anywhere, including community-based screening programs. Although and not as accurate as testing the patient's blood in the hospital laboratory, a fingerstick blood glucose test bar is easy to perform and the result is available right away. The test involves sticking the patient's finger for a blood sample, which is then placed on a strip. The strip goes into a machine that reads the blood sugar level. These machines are only accurate to within about 10 to 20% of true laboratory values. Fingerstick blood glucose values tend to be most inaccurate at very high or very low levels. So this test is only a preliminary screening study. Fingerstick is the way most people with diabetes monitor their blood sugar levels at home. Fasting plasma glucose. The patient will be asked to eat or drink nothing for 8 hours before having blood drawn, usually first thing in the morning. If the blood glucose level is greater than or equal to 126 mg per deciliter without eating anything, they probably have diabetes. If the result is abnormal, the fasting plasma glucose test may be repeated on a different day to confirm the result, or the patient may undergo an oral glucose tolerance test or glycosylated hemoglobin test, often called hemoglobin A1C, as a confirmatory test. If fasting plasma glucose level is greater than 100 but less than 126 mg per deciliter, then the patient has what is called impaired fasting glucose or IFG. This is considered to be pre-diabetes. These patients do not have diabetes, but they are at high risk of developing diabetes in the near future. Oral glucose tolerance test. This test involves drawing blood from a fasting plasma glucose test, then drawing blood for a second test at 2 hours after drinking a very sweet drink containing up to 75 grams of sugar. If the blood sugar level after the sugar drink is greater than or equal to 200 milligrams per deciliter, the patient has diabetes. If the blood glucose level is between 140 and 199, then the patient has impaired glucose tolerance, IGT, which is also a pre-diabetic condition. Glycosylated hemoglobin or hemoglobin A1C. This test is a measurement of how high the blood sugar levels have been over approximately the last 120 days, the average lifespan of the red blood cells on which the test is based. A person with diabetes should be checked regularly for early signs of diabetic complications. A healthcare professional can order some of these tests. For others, the patient should be referred to a specialist. The patient should have their eyes checked at least once a year by the eye specialist to screen for diabetic retinopathy, a leading cause of blindness. The patient's urine should be checked for protein, microalbumin on a regular basis, at least 1 or 2 times per year. Protein in the urine is an early sign of diabetic nephropathy, a leading cause of kidney failure. Sensation in the legs should be checked regularly using a tuning fork or a monofilament device. Diabetic neuropathy is the leading cause of lower extremity ulcers in individuals with diabetes, which frequently lead to amputation of the feet or legs. The healthcare professional should check the feet and lower legs of the patient at every visit for cuts, scrapes, blisters, or other lesions that could become infected. Adults with diabetes should check the soles of their feet and their legs daily with a handheld mirror, either by themselves or with the assistance of a relative or a caretaker. The patient should be screened regularly for conditions that may contribute to heart disease, such as high blood pressure and high cholesterol.